How is PCOS related to your diet? When somebody is eating too many of the refined and processed carbs, too much of sugar, too much of those coffee drinks with sugar in it, juices, sodas, refined and processed oatmeals, and noodles, fast absorbing cereals, and pastas and breads, we've been grabbing too much of them. For some people, that can really throw off their entire system into total chaos. Today, we are going to talk about something called PCOS or polycystic ovarian syndrome, which is super common. It is a common affliction that affects women, that causes all sorts of misery, from infertility to acne to facial hair to loss of hair on their head and irregular periods. Sounds terrible. So we are going to get into it today and talk about this problem. This is Mayuri Deshmukh, your coach for fitness, wellness and health. What exactly is PCOS and why should we even know about it? You may know that PCOS is a syndrome that involves irregular periods or not having any periods at all, or changes in your hormone balance, where some people have all the symptoms of PCOS, some just have a few. Now, a woman will visit her doctor to get treated for this. The doctor will ask her to regulate her diet and start exercise. You walk out of the clinic determined to start. To show some positive results with your diet and exercise before your next appointment with your doctor. But this is where you realize that you need to know more about fitness, what to do, where to start. PCOS sometimes gets undiagnosed. So what are the symptoms and what is the cause? Some will get acne a lot of times in the lower jaw, and then often they'll also gain weight. But know that not everybody with PCOS is overweight. There are a lot of women who don't have the obesity, but they are dealing with irregular periods. But for a good portion of women with PCOS, they will gain weight because of high levels of insulin. Insulin balances out our blood sugar. So when you eat a meal, the body makes insulin. That insulin tells our body to take your food and get it into your muscles so it can be used for energy. And what happens when somebody has insulin resistance is the body is not listening to that insulin. And that high level of insulin in your blood will cause you to gain weight, especially around the belly. People think it's only a gynecological problem, but actually it's a dietary problem. And it's not always dietary either, which is so interesting, right? Because there are toxins from the environment like BPA and plastics, and we are learning about how the gut microbiome imbalances can cause insulin resistance and prediabetes. So it's all connected. It's all connected. And a huge portion of people are just eating too many carbohydrates, too many refined and processed carbohydrates, combined with lack of daily movement, strength, and cardiovascular fitness. How is it treated? Insulin resistance shifts the hormone balance, and then you get this imbalance in hormones. You get the high androgens or testosterone, which is the male hormone. But interestingly, as a syndrome, it can be very individual to that person for why they have PCOS. What are the traditional treatments that you see with regular doctors giving for PCOS? So often women will be placed on birth control pills, because if they're having irregular periods or they are skipping their period, many times the physician will put them on birth control pills because it will regulate their cycle. They'll put them maybe on metformin because metformin improves insulin sensitivity. It is a very commonly used diabetes drug, so that can many times help with the weight gain. It sometimes helps with the acne and the hair growth or hair loss. But it really doesn't speak to addressing the root causes. It just patches the symptoms. So, as I mentioned already, diet is huge. Diet has a huge impact when somebody is eating too many of the refined and processed carbs, too much sugar, coffee, drinks with sugar, juices, bread, cereals, pastas, muffins. I know someone who grabs brownies when they feel low, but then they said that they do it every week. Another big common area are toxins. I see this a lot. A lot of this is related to toxins. We also know genetics play a huge role here. We know that what women are exposed to as a fetus, what has happened to their mom when they're pregnant with them, that really impacts their hormone balance and their metabolism later in life. What the mom's eating is like whatever she feels like from Zomato all day. And what's fascinating, people don't realize that when they're pregnant with their baby, it's really important that they're paying attention to what they're eating. So if they're not gaining enough weight, or they're gaining way too much weight, or they're eating too many refined and processed carbs and sugars, that really throws off the fetus, the baby's metabolism. And so, sometimes we tell the members that you can just blame it on your mom. There's a term, Garbhasanskar. Women usually try to do it right. What the mother does, what she eats, what she's exposed to, even her thoughts, feelings, all those tag the baby's genes for what happens to them in the future, and whether they get diabetes or heart disease or cancer or obesity. I mean, it's all programmed, but that doesn't mean that it's not fixable. You can do a lot by changing your choices. Then the bigger picture of the environment, your diet, lifestyle, toxins, etc., etc. It is about modifying your lifestyle and your environment to influence your genes, to change your health in every aspect. So for some people, it's harder for them than others. Like, some people will come in and they're like, it's not fair. I have to be so much more careful than my sister, right? And it's true, because there are some people that have to be so much more careful with their diet. We all should be eating a healthy diet, but some people have to be more careful with their carbohydrates than others. I would say that there are a few people who are better adapted to higher carbohydrate diets, and there are those very few I know. Those are the ones who stay skinny eating anything. But when you look at the fact, that is a very, very small percentage. Almost 9 out of 10 of us have some degree of insulin resistance. And that should get our attention. It is probably the majority of us who don't do well with a lot of starch and sugar. Some can do more, some can do less. Some can just look at a cake and they gain weight. Literally, because they're thinking about it and the insulin goes up and they put on all the fat on their bodies. I want to jump back to something we talked about, which is toxins. And I want to explain how environmental toxins and what toxins influence hormones and influence insulin resistance. Because both of those things are going on with PCOS. And I think it's something people don't really understand. There are some theories which suggest that environmental toxins were damaging probably the mitochondria, right? So the powerhouse of your cells. We also know that BPA, that plastic that's been really well studied to show that there's a connection with insulin resistance. And we've known for a long time about the connection with breast cancer and BPA. But there's also a connection with insulin resistance and weight gain. So that hard plastic they use with BPA in the linings of cans or on baby bottles. So we realized that this toxin caused weight gain, insulin resistance, and I'm sure there's a lot of other toxins that we haven't even, figured out yet, that are really influencing, well, pretty much all the petrochemical toxins, all the plastics and the fossil fuel derived toxins. We come across hundreds of these in our daily life, and you may never realize which one is affecting you through our modern living. But there are ways to reduce it, I think. Resources for finding out what household products, skincare products, cleaning products, food products that you can eat. So you need to really have to focus on figuring out the areas where you need to work on as an individual, rather than looking at PCOS as a problem which is going to stick with you. Get it? It is easier said than done, but try to focus on the solutions and don't overthink the problem. You've got to just really focus on breaking that cycle. The cycle of craving those fast absorbing carbohydrates, because what happens for a lot of people, it becomes a vicious cycle. They eat the carbohydrates, the really refined processed carbohydrates, their insulin goes up, and then they end up craving them again. They gain some weight and then they crave more and more of them, and it becomes a vicious cycle that gets out of hand. To conclude this topic, even a little bit can do a lot of damage, and the way I like to explain it is, think about it like a peanut allergy or a cat hair allergy. Sometimes if you are just exposed to a peanut dust, and you can get an anaphylactic reaction, right? So that's how powerful your immune system is. It responds to microscopic doses. A lot of good probiotics and prebiotics, the thing that feed the probiotics, and really focused on a nutrient-rich diet. And I think sometimes we don't think about how powerful that can be, right? Those phytonutrients, those components from a food, which are your vegetables, some fruits, some seeds, spices, teas, that can be really powerful. So for the body, it's not just about what you eliminate, but what you add. And that is also very true. Here are some supplements which I'd like to talk about, which can be beneficial for you. Inositol, it can improve insulin sensitivity. Vitamin D, which we know is important for, again, insulin sensitivity. Vitamin A, which is important for the skin. Omega-3 fats, which is really anti-inflammatory. People suffer so needlessly from problems that do have solutions, and it is not rocket science. It takes so long for people to get access to this knowledge, and I think I want to just end with it with emphasizing on getting yourself a good exercise program. A program that includes both high intensity interval training, good cardiovascular training, and strength training. Hope this information will move you in a direction to take the right steps for taking charge of your PCOS problems. If you like this video, please subscribe, like, share, and leave a comment.